Hi, this is Nancy Ryan with Relationship Therapy Center again. This is part 2 in our COVID-19, is it anxiety or stress, and what to do about it. So what I wanted to do today in our segment was really to talk about the difference between feeling anxious and an anxiety disorder. So most people right now are feeling stressed out is a common term, but the emotion behind that is anxiety. And, the anxious thoughts of, I don't know when we're going to get out of this. I don't know how we're going to handle this. But it comes and goes. So the difference between anxiety, the emotion, the feeling of it, and an anxiety disorder is often once that anxiety gets to a point where you're having anxious days more often than not, there could be becoming a problem. And so it's like you can't get out of that loop, that worry loop. And so sometimes that really starts affecting, even if you want to try to stop worrying. So sometimes I'll give clients some ideas about, if you are worrying, get a journal out and write about everything that you're worrying about. And sometimes that calms things down. If you have an anxiety disorder, it's really hard to stop that process. And it also becomes difficult to focus. It's difficult to focus on your day-to-day activities. It's almost like you're consumed with the level of anxiety. So it interrupts our sleep. It can interrupt our eating patterns. And we begin to feel really tired but wired at the same time. So it's difficult to settle our body down, and our body will respond. So especially with children, a lot of times it's stomach aches, but even as adults, we can feel that. Or there's a heavy pressure on our chest, and it becomes difficult to breathe. When people develop a panic attack, it can actually start feeling like you're having a heart attack. And sometimes people go to the emergency room because of that. That feels like their chest is constricted and they can't breathe. Any kind of anxiety, and the last video of our segment here, I'll talk to you about things to do for that. But any level of anxiety is to stop and accept it. Okay, my body's doing what it's supposed to be doing. Sometimes there's tension, you can't let go, you can't breathe. And rather than go, oh my God, I can't breathe, it's better to go, okay, my body's telling me that I'm tense. I'm anxious right now, and to accept it and go into that. So if this happens more often than not, when your body's doing this, it's difficulty to sleep, it's difficult to stop worrying, having more days that you're worrying than not, especially during this time, you can seek help. There's lots of things to do through therapy for anxiety when you can't get out of this. And look for our next video where I'm going to be talking to you specifically about things to do without medication, and that you can try at home first. And if those are helpful, great. You can even come into therapy and work on some of the thought processes that go on to help you minimize that anxiety. So there's lots of help versus just thinking that you've got to go get some Xanax. Sometimes Xanax is helpful for people, but it is also very addicting. So we want to make sure that we're practicing things that we can have control over to help us, and maybe use that when necessary. So look for our next video. And if you need to reach out, we're at therelationshiptherapycenter.com in Sacramento and seeing clients online all throughout California. So if you want to subscribe on the video, then we can let you know when the next video comes up about things to do for anxiety. Thanks for listening.